to the Bradford and Brooks Show, live on WBRT 97.1 FM and 1320 AM. Also, streaming live at WBRTcountry.com.
All right, welcome back to a special Friday edition of Bradford and Brooks. Jim Brooks here with my co-host Margie Bradford, coming to you this beautiful Wednesday.
Yeah.
Boy, hard to break. Friday morning, beautiful Friday morning here in downtown Bardstown. We have switched our studio guest. Mr. Carl Nett is on his way probably back to Louisville, and on the campaign trail. And our next guest this morning is Sarah Jo Best, who is Public Health Director at the Lincoln Trail Health Department. And the Health Department, I used to know this information, how many counties the Health Department serves, Sarah Jo, but I know that it's not all the counties in the Lincoln Trail District, is it?
Correct.
Okay,
We serve 6 out of the 8 in the Area Development District.
All right, well, tell our listeners a little bit. I know that, of course, covering fiscal court as a reporter and talking with Dean Watts, who's on the board, I've learned just working with him how public health is evolving from what it used to be. Mm-hmm. And so tell us, our listeners, a little bit about the health department's mission, how it's changed, and where you're heading, you think.
Okay, so when I think about public health today, there's a lot of things that are transforming us, and we really are in a public health transformation in the Commonwealth of Kentucky and really nationally. There's driving factors that have affected that, things like the expansion of Medicaid in Kentucky, where more individuals had access to primary care homes. The Affordable Care Act, things like that have really changed our dynamic. Now, our mission has always been the same. Good health and a safe environment is the mission of the Lincoln Trail District Health Department, and really just prevention and safety and building resilient communities. How we do that has really changed over the year. And I laugh sometimes and say that we're not your mother's health department that you knew. And so I just want people to be aware of why we're changing, and how that affects them and how they can use their health department in a more meaningful way, from elected officials to the public, to our clients. And really the biggest change I think that most people will notice right away is the shift from clinical services more into what we call the social determinants of health, which are more social and policy and built environment type initiatives. So what we know, that we were very heavy on clinical services for a long time, and counseling and education within the clinical world, and we've really made a big shift from that. And the reason why we did that is because science and research are telling us that really has less impact on populations at large. Where we can make a biggest bang for your buck, if you will, as resources become a little tighter, is really moving upstream into social determinants of health. So what are those base factors that really guide and determine whether someone's healthy or not? So things like housing, education, economy, jobs, things like that, early literacy, things like that are going to be indicative of whether or not people have the same opportunity at long-term health. Building resilient communities, looking at built environment, looking at the policies and whether they support health or whether they maybe have unintended consequences that have negatively affected our health.
Well, can you give us an example of what you mean by that? I mean, that all sounds very grand, but doesn't really tell me what you're doing now. And
right. So, and that's thank you for doing that, because I want to give some examples that I think that people don't naturally think public health. So some of those things that we're doing, we've done a pilot project right now. It is only in Hardin County, but we are working right now to try to get it expanded through the development district. It revolves around transportation. And so that came up working with a local feeding site that people were using the ambulances inappropriately. So that was tying up community resources, taking ambulances off the street for non-emergent needs. And that people were having a hard time getting to work because they didn't have their own means of transportation, so they were having to bum rides. And that wasn't always dependable. So why does public health care about that? A, you've got an access to health care issue, and B, your job and sustainment of employment dictates whether or not you're going to have a house, whether or not you're going to be able to afford food, healthy food, to be able to have nutritious meals, whether or not you have access to health insurance, because and whether or not you live in poverty. What we know is those that live in poverty live on average about 20 years less than those that don't, and so that is it's going
That's a
down to
public health issue, yeah.
transportation. That's a public health issue.
So how
what we
are they
did-
tackling that particular issue?
So we're applying for grants. We applied for a grant for a pilot project in Hardin County with the hopes that we could get that out to all of our counties. There's another grant that's being applied for. It's been expanded out to involve more community partnerships. Community Action is now on board with us with that. We think that we can also get local industry involved in that. But what we did is we created partnerships with cab companies and different entities like that. And through that grant, we were able to do some vouchers. At first, participation in the program could be free for participants. As they went on and sustained employment for a while, they were able to then foot part of the cost of that. And then as we continued on, what we found, what our data, we tracked that to see if it was successful or not. What our data demonstrated is not only were they able to sustain employment, which means they also sustained health insurance, but eventually they were able to get, if they were homeless, they were able to get their own housing. It takes a while to build up money to be able to put down deposits and things like that. And then eventually they were able to get their own mode of transportation through sustainable employment.
This is how long has that taken?
The turnaround time for that was not very long. We've been doing that program now, I would estimate about 1.5 years there, but we've been able to
So in
demonstrate.
1.5 years, you've been able to see improvement in that.
Well, I can see where those partnerships could help, industry partnerships could help provide funding to make these things possible, because it's also a benefit to workplaces and industry
Absolutely.
to make sure there's nothing worse than absentee employees for getting things done, especially, when you depend on those employees for a product or service. And I can tell you that Hardin County is a big county. I lived and worked for the newspaper over there, and
It's spread out.
but getting from one place to another, and if your car is broken, I mean, I used the cab company a number of times, and thank heavens they were there, or else I would have been, I'd been up a creek without a paddle trying to bum rides, and that's, that's tough. That's a tough way to have to go. So this sounds great, because without transportation, you can't be a good employee.
Right.
Wow, that's interesting.
Now, here in Nelson County, can you give us some specific instances of what's happening here in Nelson County?
So in Nelson County is one of our higher overdose areas, and we've been really concerned about drug use in particular in Nelson County. And so in July of 2017, we did start our harm reduction syringe exchange program. And from July of 2017 through March of 2019, we've had 168 non-duplicated patients. So that means that individuals have been through it, 744 visits. One of the things that we've been able to do beyond just exchanging syringes to ensure that those are not reused and we prevent communicable disease within our community, but we've also been able to provide immunizations. So one of the highest risk groups during the hepatitis A outbreak, which for us has really ceased in our area. It hasn't ceased in the state, but it has in our area. We were able to provide those Hep A immunizations to participants. We're able to test them for HIV and Hep C, possibly help them get into treatment if they test positive. We've been able to educate to keep them out of the ER, again, reducing unnecessary healthcare expenditures, but also keeping them well and referring them into treatment. A new program that we're rolling out right now is we applied for funding And this is going to be piloted in Nelson County. So we do this a lot. When you have 6 counties, you kind of figure out what the biggest need is in each county, and you pilot it there, and then you look at expanding it out. But in Nelson County, we're getting ready to roll out what's called Community Reinforcement and Family Training. CRAFT is the acronym for that. It's a highly effective and evidence-based program to support family members living with loved ones who are abusing alcohol or drugs but refuse to enter into treatment. And what we know of studying that program is that 70% of the people who use drugs that received CRAFT will go into treatment within the first year. And so we're hoping to have a big impact. The other thing that with the CRAFT program is Medica is a partner with us in the Narcan part. And so they will be able to do education for these family members and dispensing of Narcan, which is the medication when someone overdoses that can potentially save their life. And so, or if they go through our syringe exchange program, we'll be able to give a voucher to them to be able to take that to Medica and get that Narcan. And so that's something that we've really worked on in Nelson County. I have to give a shout out to the Nelson County Detention Center and Judge Watts too, with Hep A. They were very proactive. We worked with them very well in the initial outbreak for that. And I think that's something too that people may or may not realize that public health does every day, which is communicable disease control. And so we did end up having about 103 cases throughout our district of hepatitis A, but keep in mind that we serve a population size of about 230,000 people.
Wow. And of course, any sort of detention center, you've got so many people in a closed facility, it's just ripe for the spread of anything communicable.
And the major risk factor was illicit drug use. So that really, most of our cases, not all, but most of our cases we saw were in detention centers or in drug treatment facilities. So, and our syringe exchange program gave us another venue to reach a hard at-risk population.
Okay, I know that there's critics of syringe exchange programs that it's enabling, but drug habits. But really, I think your data shows that it's enabling recovery efforts and better health for the addicts, because they're introduced to an avenue for treatment. Nobody wants to stay an addict. You know,
and they're going to use them. So if they have to reuse, that's what they'll do.
But through the health department program, that's the contact for other social programs and other health and wellness.
Right. While they're
So
in there, there's other
and you build that
gateways.
relationship with them. So when the time comes and they want to seek treatment, they know what to do and who to talk to.
And really, if you think about it, when you come and participate in something like the syringe exchange program, you're already recognizing that the behavior that you're doing is potentially dangerous to you and those around you. And so they are a little bit further ahead in what we call the stages of change when they come in to participate. And so we meet them where they are in a non-judgmental way and make sure that we get them the resources that they need or refer them. You know, sometimes they're identifying other resources that they may be in need of. And so that gives us the opportunity to build that relationship. And then when they're ready, to assist them in transitioning into some type of treatment.
So now you're no longer really dispensing any clinical services like giving shots and that kind of thing?
We do immunizations. We do a lot of immunizations. We do sexually transmitted infection testing and treatment. We do tuberculosis still. So any of those kind of communicable disease things, we still do that. We actually, when we quit doing family planning and prenatal services and breast and cervical cancer screening, which were available within our community. And so that was part of that was being a good steward of your resources too. If things are available in the community and readily, then maybe public health resources shouldn't have been used in that way because we have to make sure that we assure our services are met. And so sometimes that as money began to dwindle, those two things started to compete. And so to make sure that we were being good stewards of the tax dollar and our funding sources, that helped drive that decision too. We've actually seen an increase in our immunizations in our clinics since we've transitioned out of that. And I think that really what happened was their appointments weren't available. And so we've seen an increase in testing for sexually transmitted infections. And I think that now the appointments are a little bit more readily available, and so we're able to accommodate that. We try to limit our immunizations to those who may fall through the cracks.
Right.
So if you have private insurance, most of the time we're going to refer you to your primary care provider. Continuity of care, you know, if something happens and identifies and they need to help you with that, then that's available. But really the uninsured or the underinsured is who we primarily target, and it's more on communicable disease type immunizations. And then, of course, we have the Women, Infant, and Children program. At our health departments, we do a lot of that. That's a supplemental nutritional program. You can qualify either by income or just nutritional risk. If a child is failing to thrive, they may qualify for that. We have
What's that called?
Women, Infant, and Children program. It's WIC.
WIC, yeah.
We still do that. That is a bulk of what we provide in our clients. And what we're identifying, we're actually screening our clients when they come in, doing kind of a social determinants of health assessment, and seeing, we're asking questions like, do you worry about whether or not you'll have your next meal? Have you struggled with paying your light bill? Have you had transportation issues? Really assessing that so that eventually we'll be able to inform policymakers and community partners on what our biggest needs are in our community. But hunger is coming up quite a bit. So we want to make sure that people do know about our WIC program. You can go online and look at our website, or you can call one of our clinics and see if that may be something that would benefit you. But we would highly encourage you to participate in that. And we also have breastfeeding consultants that will be rolling out to help mothers with that as well.
Well, I think the information you provide back to policymakers is critical, because it gives them the reason to continue to support a specific program, or reason why they should support a new one. Because I think everybody is hesitant to get behind something brand new, especially if there's a cost involved, or clearly, when the health department's looking at something, they've got you've done the research, and you have identified this as truly a need.
Right, and that's one of the shifts we've really made in the past 5 years, is that we really quit doing feel-good type things or things because we always did them, and started digging down into data, tracking our local data, knowing what our highest risks were, and then using only evidence-based or research-based initiatives on what we've identified as the biggest risk to health and safety in our communities. So it's not your mother's health department anymore.
Well, there's so much evidence now of the fact that really we have the worst record on births, and how mothers health. Is there anything being done about that?
Actually, we have a program that's called the Maternal Child Health Program, and so Jessica Bickett is the one that covers Nelson, Marion, and Washington counties, and she works every day on initiatives like that. She works with the OBGYNs. We work with our local hospitals, pediatricians, community groups, but we do everything. And then I would also say that we have a HANDS program, which is also available in each one of our communities. That is a home visitation program that we really, our goal is to get those patients prenatally so that we can begin to work with them. If they participate in programs like HANDS, research also demonstrates that we have higher birth rates, better bonding, less child abuse. And so it's a voluntary home visitation program that we provide that looks at just the development, nutrition, nurturing of a child, which I think has become critically important and might be one of our best prevention tools for continued response to drug abuse. I really do think with adverse childhood experiences, that drives risky behavior. And what we know is Kentucky has not only do we have a higher rate than most states of children with adverse childhood experiences,
Yeah.
but our children typically have more. And so what I mean by that is if the average for another state is 1 or 2, Kentucky's is 4. So that's things like having a parent incarcerated, experiencing child abuse, those types of things, just risk indicators. And so I think that prevention programs like that go in and work with people before they even have the baby and talk about things like how to bond with your child, how to properly discipline, what they can expect development-wise. I think sometimes we take that for granted. If we had it, that everybody gets that, but
Right.
we learned to parent from our parents, and not everybody is coming from a home where they had a good skill set for that. And even
Very
any
true.
parent can use some help.
Absolutely. Absolutely.
They don't come with instruction manuals, and it's tough.
No. I've read about how the addition of one adverse experience for a child, how much that raises the risk for their having problems later on. So if they have multiple adverse incidents, then it's raised exponentially. So,
Right, and we have programs right here in Kentucky that help prevent that, but I don't know that we're tooting our horn enough and getting the information out there. And then sometimes we're restricted on how many people can participate within
Right.
the program because of funding.
Sure.
So that's something that we need to continue to advocate for, and to make sure that we're fighting for the ability to get that out to as many families as we can.
great.
Well, sometimes the most vulnerable have the weakest voice, to lobby for funding. And there's there's all resources are always, there's never enough to go around.
Right.
But if you make the need known as best you can. Now the health department no longer does home health, I believe. Now, do you all make, if you see a need, do you all make referrals to other agencies, or is that something?
Typically,
No,
no.
okay.
Typically, that doesn't come up a whole lot. I would say more referrals are made to primary care providers if we need to do that, social type agencies that meet those types of needs. And then we have a First Steps program.
Okay, I was going to ask you about that.
Which is for children with developmental delays through
Yeah.
the age of 5. And a lot of times our hands employees will notice that on their visits with these children, and they can make a referral into that. The HANDS program addresses and help. What we do is kind of manage the needs of that child, making sure that the appropriate services are there and are working for them. And then we help make that transition into preschool, and it's just making sure that child gets the best start possible. So a lot of referrals into that, I would say, and an increase in that, especially, and I can't say exactly why, but I can't help but to think that some of that may be because of Kentucky's epidemic with drug use.
Sure.
Oh, yeah.
Sure, and I know that schools understand the importance of, even their preschools are now want to have their students kindergarten ready. And there's certain benchmarks that they're wanting the preschools to meet. So, in that early education, it's one of those cases, if you don't get it at the age appropriate time, you're behind from the beginning.
Right.
And so it makes it tough.
We actually hand out books and encourage reading from the very beginning. We do that through our HANDS program, but we also do that in our clinics through our WIC program. And so we give our participants books and talk to them about how important early literacy is and how important reading to their child and setting that stage. Again, something I don't think that people think public health.
No.
But again, if you
No.
get a bad start in school, you're going to be at risk,
Right.
continuing on from risky behavior to low educational attainment to employment.
Well, I think you can't emphasize enough the importance of children seeing their parents do an activity too.
Right.
If you're not read to, then reading maybe doesn't come up as an important activity
Right.
for you.
Right.
Well, Sarah Jo, we're just about out of time this morning. Thank you for taking time to come in. And what would be the message you want to leave with our listeners as far as public health in the Lincoln Trail Health Department?
I think the biggest misconception is that if you don't come through the four walls of the health department, that you don't benefit from public health. And I would just rephrase that in that if you feel good about going out to eat, if you feel good about buying your groceries, if you feel safe, that you're not going to get a horrible communicable disease and shorten your lifespan. If you feel good about those things, there's a reason why you feel good.
WBRT
And it's because
Bardstown,
somebody's out there
1320 AM and
working on your behalf,
97.1
and a lot
FM,
of
the
times
most
that's public
listened
health.
to radio
All right.
station in
Thank
Nelson
you, Sarah
County.
Jo. We're out of time. We will see you next Wednesday.
AP Radio News. I'm Ed Donahue. President Trump covered a lot of topics on his